Let's go over some trach care tips. The first one is to always keep extra supplies at the bedside. You want to keep an extra trach of the same size and a smaller size. You'll want to keep suction equipment at the bedside and sterile supplies on hand in case the trach becomes dislodged or blocked. Next, we want to monitor for skin breakdown regularly. You want to assess the skin around the trach site for any signs of irritation or breakdown. This is important especially for patients who've had a trach for an extended period of time. Next tip is to always keep the area dry. Moisture around the trach can increase the risk of infection, so you want to use dry split gauze when performing trach care and make sure the stoma is dry. Next tip is to avoid tight trach ties. When securing the trach ties, make sure they're snug but not too tight. You should be able to slip one finger under the tie to prevent discomfort or irritation to the skin. And lastly, we want to assess for secretions. You always want to note the color, consistency, and the amount of secretions coming from the trach. This can indicate the patient's respiratory condition. Remember, any changes in these secretions may signal an infection or other issues. That's all for trach care tips. Happy studying, future nurses.